A heart attack, medically known as myocardial infarction, occurs when the heart muscle does not receive enough blood flow and oxygen due to blockage in the arteries supplying blood to the heart, caused by the accumulation of fat and cholesterol. As a result, the heart muscle begins to die. Since a heart attack interrupts blood flow, restoring it to its previous state is crucial for survival. Otherwise, the damage to the heart can be fatal. Therefore, it is essential to seek medical attention immediately when symptoms of a heart attack are felt. What is a heart attack? A heart attack, also known as myocardial infarction, can be defined as tissue death due to a decrease or complete cessation of blood flow and oxygen to the heart muscle as a result of blockage in the coronary arteries. Symptoms experienced during a heart attack, especially chest pain or tightness lasting for several minutes, are caused by the heart muscle being deprived of oxygen. Reduced oxygen supply to the heart muscle can lead to damage and death of the heart muscle. Reduced blood flow not only affects the heart, but can also have lethal consequences for other parts of the body. Detecting early symptoms of a heart attack and seeking medical help promptly can save a person's life. Types of heart attacks. A heart attack, a condition where oxygen and blood flow to the heart muscle are reduced or completely cut off due to blockage in the coronary arteries, is divided into three subtypes: ST segment elevation, myocardial infarction; STEMI, non-ST segment elevation, myocardial infarction; NSTEMI, coronary artery spasm. Causes of heart attacks. A heart attack occurs when fatty and cholesterol-rich deposits block one or more coronary arteries, which supply blood and oxygen to the heart. This blockage is often caused by plaque buildup in the inner walls of the arteries, composed of substances like fat and cholesterol. While some individuals who experience heart attacks may not have coronary artery disease, the following are common causes of heart attacks when combined with coronary artery disease: coronary artery spasm, high blood pressure, high cholesterol, diabetes, rare medical conditions, trauma, obesity, electrolyte imbalance, tear in blood vessels, smoking and drug use, hypoxia, oxygen deficiency in the blood, being 45 years old and above, genetic factors, lack of physical activity, stress, unhealthy diet. Symptoms of heart attacks. Symptoms of a heart attack can vary, and sometimes a heart attack can occur without any symptoms. When symptoms are present, they may include mild or severe chest pain, shortness of breath, pain or discomfort in the jaw, neck, back, arm or shoulder, nausea, dizziness, or abnormally tiredness, which can be felt as signs of a heart attack. Common symptoms of a heart attack include chest pain, pressure, and tightness are the most common symptoms of a heart attack. Shortness of breath, making breathing difficult. Pain radiating to the jaw, back, neck, and abdomen during a heart attack. Pain and numbness in the left arm. Burning sensation and indigestion. In the stomach, nausea and dizziness. Cold sweats. Feeling excessively tired. Risk factors for heart attacks. Individuals with the following risk factors are more susceptible to heart attacks: users of tobacco products, including cigarettes and hookahs; individuals with high levels of bad cholesterol, LDL; individuals with low levels of good cholesterol, HDL; people with diabetes, sugar; people with metabolic syndrome; those battling obesity; people with a sedentary lifestyle and low physical activity; men over the age of 45, women over the age of 55; drug users; people with hypertension problems; individuals with an unhealthy diet; those with a history of preeclampsia; people with autoimmune diseases; individuals with a family history of heart disease. What to do during a heart attack? The most crucial aspect during a heart attack is to seek immediate medical attention as soon as symptoms like chest pain are experienced. Nearly half of the deaths related to heart attacks occur within the first hour after the onset of a heart attack. Therefore, early recognition of symptoms and prompt medical assistance can save a person's life. If a person is alone during a heart attack, there is no maneuver that a person can perform to open the blocked artery during a heart attack. Firstly, the person should inform their relatives via phone as soon as the pain starts. The door of the room should be left slightly open to ease the work of the person coming to help. Strong coughing might temporarily increase blood flow. Although the possibility of dislodging a newly formed clot is very low, the person should cough forcefully by covering their nostrils. If aspirin is available at home, it should be taken with a glass of water. Absolutely nothing should be eaten or drunk. The window should be opened to allow oxygen into the room. Help should be awaited lying or sitting. Standing should be avoided at all costs. Since a person coming to the hospital with a heart attack should not have any trauma problem, if the person has fallen and hit their head, the treatments for a head injury cannot be performed due to the heart attack. Exercises should not be performed to reduce pain. Cold or hot water should never be taken. Especially cold water is very dangerous in such situations because it constricts the heart vessels and can also cause the non-blocked vessels to narrow. If a person near you is having a heart attack, if you do not have health experience, do not intervene with someone having a heart attack. Do not give heart medications belonging to other patients or yourself. Immediately request ambulance assistance and take the patient to the nearest fully equipped hospital. Lay the person down in a suitable place during this time. Elevate their feet above heart level to improve blood flow to the heart. Loosen any tight clothing and loosen the tie, etc. The important thing is to take the patient to a hospital where examinations and treatments can be performed properly and in the right place. How is a heart attack diagnosed? It is crucial to diagnose a heart attack quickly and administer the correct treatment. The treatment process begins with ambulance personnel on the way to the hospital, and early intervention prevents damage to the heart muscle. Upon arrival at the hospital, the doctor will perform tests to diagnose whether a heart attack has occurred and to measure the extent of damage and determine the best treatment method. The following tests are used to diagnose a heart attack. Electrocardiogram, EKG, should be performed immediately upon arrival for every patient with chest pain or suspicion of a heart attack and should be repeated afterwards. Blood tests, particularly tests indicating heart damage, such as troponin, allow diagnoses in patients who do not show signs that require immediate angiography. These tests help both in diagnosis and in determining the extent of heart damage. Coronary angiography, cardiac catheterization. It is the definitive diagnostic method to show the blocked artery and to intervene. It is performed through the wrist or groin, depending on the suitability of the patient. Angiogram. Through this test, areas where blood flow is very low or absent are determined. Cardiac computed tomography scan provides a detailed scan of the heart. Cardiac MRI provides an internal view of the heart. Treatment methods for heart attacks. Every patient who presents to the emergency room with suspected heart attack should consult a cardiologist. The doctor may monitor the patient's condition and perform angiography to check the heart vessels. Depending on the angiography results, medication, stent placement, or surgical intervention may be necessary. The faster the treatment process in a heart attack, the less damage the heart muscle sustains. The primary treatment for a heart attack is to open the blocked artery without delay. While battling life-threatening complications like rhythm disturbances or cardiac arrest, Treatment to restore blood flow in the blocked vessel area should begin promptly. Common procedures in heart attack treatment include balloon, angioplasty. Using angioplasty, a balloon is used to open the blocked artery or plaque buildup is removed. Stent, coronary stent placement is usually performed along with balloon angioplasty to ensure complete opening of the artery and to prevent reblockage. Bypass surgery. Blood vessels taken from other parts of the body, such as the arm or leg, are used to restore blood flow to the blocked coronary arteries. Heart valve. Surgery. In patients requiring surgical intervention in heart vessels, if valve disease is also present, valve repair or replacement may be performed simultaneously. Cardiac pacemaker. A pacemaker is an implanted device beneath the skin designed to help maintain a normal heart rhythm. Some heart attack patients may require different types of pacemakers in the short or long term. Heart transplant. Heart transplantation is an advanced treatment option to be considered in severe cases where heart attack results in permanent tissue death in most of the heart. Medication therapy may include anticoagulant drugs, also known as blood thinners. These drugs reduce the blood's clotting effect to prevent clot formation and stop existing clots from growing. Antiplatelet drugs. These drugs can be used with other medications to prevent the formation of new blood clots and stop existing blood clots from growing. Patients with a history of heart attack, angina, or those who have undergone stent and bypass surgery are usually prescribed lifelong antiplatelet drugs. Beta blockers. These drugs help relax the heart muscle, slow down heartbeats, and lower blood pressure. The use of beta blockers reduces the risk of heart attack due to the heart's workload. Beta blockers may also be prescribed for arrhythmia or angina. Blood pressure medications. ACE inhibitors widen blood vessels to reduce pressure on the heart. They are used to lower blood pressure, improve heart function, and increase the chance of survival after a heart attack. Angiotensin II receptor blockers, ARBs, work similarly to ACE inhibitors. If there are side effects such as persistent cough from taking ACE inhibitors, these may be prescribed. Nitroglycerin. These drugs dilate blood vessels to increase blood flow to the heart, preventing or treating chest pain or angina. Statins. These drugs help lower cholesterol levels, reducing the risk of heart attack. Statins may be prescribed to people who have had a heart attack even if their cholesterol levels are within normal limits. Thrombolytics. These clot-busting drugs dissolve blood clots that narrow or block arteries. They are given by injection into the blood vessel. To prevent a heart attack, the following lifestyle changes may help reduce the risk. Quit smoking, engage in regular, especially heart disease-appropriate exercises. Individuals over 50 who lead a sedentary lifestyle should consult a doctor before starting an exercise program. Regularly see a doctor for blood pressure and cholesterol monitoring. Maintain weight control. Follow a low-fat, low-cholesterol, and low-salt diet. Prefer healthy fat options like nuts, avocado, olives, and olive oil. Consume plenty of vegetables, fruits, and whole grains. Limit salt intake to only 5 to 6 grams per day to prevent hypertension. Consume various healthy protein sources such as seafood, fish, legumes, beans and lentils, and nuts. Pay attention to lean meat consumption, limiting red meat to 1 to 3 times a week. Monitor and control diabetes. Avoid stress. Avoid alcohol or limit its consumption. These lifestyle changes may help reduce the risk of a heart attack and are important for maintaining heart health. As with any health condition, it is important to consult a doctor before implementing these recommendations.